Hi, my name is Kate and welcome to our channel. Today I'm going to have a conversation with Dr. Thomas Verny. He's a psychiatrist and he had a lifelong interest in memory and mind. He is the author of many books, one of which is The Secret Life of the Unborn Child. And the most recent one is Embodied Mind, which we're also going to discuss during our conversation. It's available in Greek. And I hope you will enjoy our conversation. And if so, please don't forget to like the video, subscribe to our channel, and share it with your friends. I was thinking that maybe we could start with the idea of cellular memory and how it works and why this is important. And then from there, we can build the bridge into the prenatal experience of a child and how that is influenced by the environment and the mental health of the parents. I think that aspect is particularly interesting for me. Sounds good?
Fire away.
Dr. Verny, thank you once again for joining this conversation and for this possibility to have it. Maybe you can start with the explanation of the idea of cellular memory and why is it important to understand in the context of parenting.
Well, when I wrote The Secret Life of the Unborn Child, which was in 1981, 82, 42 years ago, I totally believed that we had good scientific evidence to show that children from the age of 6 months, that is 6 months after conception, at the end of the second trimester, had the biological substratum. They had the science to show that they could remember things that happened to them from the 6 months on. And so that was the early 1980s. And that was pretty revolutionary at that time. And I ran up against a lot of resistance by scientists to accept that. But it has become accepted now. Nobody really doubts it too much. But over the years, I've always been kind of troubled and puzzled by the fact that sometimes people would relate to me experiences that they had in utero, which went further back in time, further back than 6 months, all the way to conception sometimes. And I also observed that there were people who seemed to have certain problems in life, like phobias, anxieties, which only made sense in terms of certain experiences that their parents experienced before they were even conceived. So I wondered about that. And about 9 years ago, I read a medical journal in which a 41-year-old French civil servant went to see his doctor because of a weakness in his left leg. And his doctor did all kinds of investigations, tests, etc., including x-rays of his skull. And to the doctor's total surprise, he found that the man had virtually no brain. He had a thin crust of brain tissue, like a crescent of brain tissue, and the rest was all water, cerebrospinal fluid, as we call it. Yet this man, 41 years old, had 2 children. He was married. He was gainfully employed in the French civil service. So I thought to myself, how is this possible? How can a person function so well with no brain? And then I started doing research, as is the way I do things. And I found that actually there were a lot of cases described in the medical literature where people have had half their brain or sometimes even more of the brain removed because of various lesions for whatever medical reasons. And many of them, not all of them, but many of them functioned very well. So the idea came to me that the only way that this could make any sense at all was that there was some kind of a backup system, just like your computer has got a backup system. So in case anything goes wrong with the computer, you still can find your work. So I thought there must be a backup system. And where is the backup system? Well, it has to be in the rest of the body. That's when I started doing research on what the cells in the body are capable. And so in my book, The Embodied Mind, I describe chapter by chapter various investigations which show how incredibly smart our cells are. And it is not one cell by itself, but it's all of them working together as a net, just like the internet, working together as a net that constitutes their smartness. And so, why is that important? Well, one of the important things is that scientists, medical doctors, neurologists have spoken for a long time about psychosomatics. Now, observe the wording here, psychosomatics. And since you're in Greece, sorry, you know that psyche means mind, soul. And so what they do is that they put the brain first and the body second. Psychosomatics, somatics meaning the body. And what I have seen is that this kind of an emphasis on the singular importance of the brain is wrong. It does not serve us well. It does not serve humanity well. It does not serve science well. It does not serve our health well, because there are so many instances when it's really the body that determines what happens to us. And one of the best examples, for example, is our gut, our gastrointestinal tract. We have like millions and millions of gut bacteria and viruses, something like 2.5 kilograms, which is called the microbiome, the bacteria in our gut, which serve an incredibly important function for our health, but also disease, depending what kind of microbes we carry. So having a diverse microbiome is one of the fundamentals of good health. And so this microbiome in the gut constantly produces substances which go to the brain. So it's really somatopsychics rather than psychosomatics that seems to be much more important. And also because it is something that we can do something about in terms of practical interventions. We can't do anything about what's happening in our brain, but we can do a lot about what's happening in our gut. We can do a lot about what's happening in our liver, our kidneys, our heart, and all of these organs and tissues send messages to the rest of the body. I mean, if our audience should carry away one message of mine, it is that everything is interconnected. As we speak now, for example, everybody who is listening and I who is talking, we are constantly, different genes are being activated, different genes are being put to sleep. Our body, all the cells are in a constant change of flux. And so what we put into our bodies, the environment we surround ourselves with, the people that we interact with, all of that is just so incredibly important. So that's where cellular intelligence comes in.
First of all, this example with the French man without the brain, is this person still alive, or just out of
That
curiosity?
I don't know. That it nobody, I've been talking about this for the last 2 years since the publication of my book. Nobody has ever asked me that question. I don't know. He was described like 9 years ago in a medical journal. He was, I guess, 41 at that time. He probably is still
Yes.
alive. I hope he is.
Yeah, but it's just an incredible story.
Yeah, and it's true.
You were talking about the cellular
Yes.
intelligence. Could you explain a little bit more what is this?
Cells are so small, you cannot see a cell with the naked eye. The only cell you can see with the naked eye is the ovum, the egg cell. All the other cells are so tiny you cannot see them. And in our society, we have this kind of a prejudice. We like big things, and we are not particularly interested in small things. And these are very, very, very small things, as are bacteria, for example. But cells are incredibly, incredibly complex machines with tremendous number of things going on inside of them. And just to give you an idea, let's say, of the intelligence of a cell, if, for example, one cell is diseased in some way, it is not healthy, it has a problem, other cells around it will start sending nutrients to that cell, trying to take care of it. Just like trees have roots. So those kinds of roots then extend from one cell to another and try to assist them as best they can. But I think the best way to perhaps describe the intelligence of cells is to emphasize the fact that they contain fragments of memories, tiny, tiny, tiny fragments of memory, which, if they all work together, then create one big memory. And we have not come to a point in our science where we can decipher this, where we can get inside a cell and find out, what is this cell remembering? But one of the examples, one of the best examples of how cells contain not just memories, but much more, is given to us by heart transplants. One chapter in my book deals with that, and that is a fascinating area of research because, just very briefly, there have been many case histories described where the person who has received a heart from a donor, so the recipient's personality suddenly changes. So there are descriptions of, for example, a woman who was never interested in men, who was a vegetarian and was only interested in one kind of music, folk music, no interest in classical music. She gets this heart transplant, and suddenly she changes into becoming interested in men, becoming more heterosexually oriented. Her musical taste changes. She becomes interested in hard rock. And a person who has never eaten meat suddenly loves hamburgers. And then she finds out that she got the heart, which she did not know. She got the heart of a 16-year-old guy who died in a motorcycle accident, and he loved that kind of food and that kind of music and was very interested in the opposite sex. So these are the kinds of transformations that happen, and there is no other explanation. Heart surgeons, of course, do not want to accept this at this time. They do not ask their patients whether they have had any changes in personality. So they never get these reports. And patients themselves picked up on the fact that somehow people might think of them as crazy or strange or whatever. So they keep quiet about these things unless you ask them and unless you give them permission to speak. And you were talking about women in your world where you live in Cyprus and areas close to it, not being allowed to speak and not being allowed to stand up for themselves because culturally it's frowned upon. Well, it's the same thing also in medicine. Certain things are allowed and certain things are not allowed. When I first wrote The Secret Life of the Unborn Child, and I wrote an article which suggested that drinking alcohol during pregnancy was a really bad thing. Oh, you wouldn't believe the attacks from obstetricians that came my way. How could you say that? Alcohol is good. It helps to relax the woman. It's fine. Smoking is fine. Thank God, all that is gone. And things gradually change, but it takes a while.
And by the way, if we're talking about alcohol and
Smoking.
the data from the research and from your book, at least if you ask the obstetrician now, they will say there is no clear evidence. It's better to avoid, but it's not like super clear. So I want your opinion
What
on
does
that.
it take for something to become super clear in the minds of these people? I wonder. It is super clear. It is absolutely super clear. Obviously, we don't know how much alcohol is going to do how much damage. Obviously, a lot of it will depend on the person. There are some people who are more resilient than others. There's no doubt about it. When I speak at various meetings, there might be 200 people, let's say, sitting in the audience. And after I finish speaking and say how bad, particularly tobacco and alcohol is, somebody will put up their hand and say, my mother smoked 2 packages of cigarettes every day and she died at the age of 90.
Yeah.
So there. What do you make of that, Dr. Verny? That is just simply stupid. Just because one person survives, there are people who survive almost anything, but that doesn't mean that 99% will not suffer. So just because one person survives smoking for the rest of their lives doesn't mean anything, does not disprove the fact that smoking is bad for you. And I will tell you what smoking and alcohol do. they interfere with the growth of neurons. And that can happen in many different ways. Usually it happens genetically, that they affect the genes that are in control of the blueprint. So then, if there is not too much alcohol, not too much LSD, not too much tobacco smoke, nicotine, all that kind of stuff, if there is a limited amount of that, it will interfere in a limited way. If there is too much, you will actually have destruction of neurons. So instead of being born with, I don't know how many billions of neurons, you're born with less. But what is also important is that the connections in the brains will be affected by that, so that the person will not be able to have the right connections, which may very well lead to autism, schizophrenia, depression, and other sort of psychoneurological diseases later on in life. So I think that because we don't know how it works 100%, and we don't know how much a woman can take without affecting her child, the best thing is not to have any. Okay. I mean, why, why play with this? It's like playing Russian roulette. Okay. Just because I click once and it didn't kill me doesn't mean that it won't kill you on the next click. So I mean, I just don't understand these obstetricians who say, well, it's not, 100%. It's sufficiently clear that it is unhealthy. So why do it?
I was thinking about these adverse childhood experiences that we have enough data right now from a lot of research that yes, they impact the long-term
Yes,
effects. They have long-term
absolutely.
effects further in the life. But what is interesting that usually when the scientists they talk about adverse childhood experiences, that starts from being born onwards.
Yes,
So I would love you to go before that, the preconception, the conception, and all.
absolutely.
How does the and what kind of experiences and how exactly they could influence the future of the child and the experience of the
Well,
child?
stress in real life, like in the living life, okay, you and I living post birth, right? In the post birth life, we know that stress is the worst thing that can happen to you, okay? We know very, very clearly what happens to us when we are under stress. Just a little bit of stress, and there's a good chance that you're going to develop a cold or perhaps a flu or bronchitis or anything like that, because our immune system goes down right away under stress. That's just one of the many things that happens under stress. Now, why in the name of heaven would that not affect a pregnant woman? If it affects you and me, why would it not affect a pregnant woman? And anything that affects a pregnant woman, of course, who is totally in contact with the child that she's carrying through the placenta and the placental circulation, everything that she experiences goes into her blood, and from her blood, it goes into the baby's blood and body. So we all know that when you are under stress, it's your sympathetic nervous system which is activated, which is the fight flight activation. So you produce a lot of adrenaline and a lot of cortisol. It's your adrenal glands which are stimulated, which are little glands just sitting above the kidneys. And so when you are under stress, the stress mechanism, the fight flight mechanism is activated. And so what happens, what is particularly important for pregnant women to realize is that when they are under acute stress, I'm not talking about being late for an appointment and running to catch a streetcar. That's fine. I'm talking about either acute stress, for example, finding out that your husband has just lost his job, or your mother-in-law has passed away, something like that, something really big, or chronic stress, ongoing long-term chronic stress. For example, being a single mother and not even knowing who the father of the child is, and not knowing whether you're going to keep the child or give it up for adoption. So all of those thoughts kind of impinge on your mind, and you are constantly under chronic stress. So either acute or chronic is what we are talking about. When that happens, you have this outpouring of adrenaline and cortisol. And what happens is, because the body is getting ready to fight or to flee, in order to do that, the body very cleverly takes the blood away from the internal organs, like the stomach, for example, and sends it to the arms and the legs so that you should be able to fight and to run. Makes a lot of sense. Unfortunately, when you are pregnant, it also takes blood away from your uterus. So suddenly, the child who depends on the circulation from the uterus on its life is being undernourished. It doesn't get enough oxygen, it doesn't get enough nutrients. And if that persists for a long time, you don't have to be a doctor to realize that this is not going to lead to a healthy development. It's so simple. It is so absolutely tragically fundamental to understand. So when you're pregnant, you have to avoid stress as much as possible because it's the worst thing you can do for your child. On the other hand, because we want to also be positive about things. On the other hand, it's really, really important to talk to the child when you are pregnant. And just to give you an example, I was being interviewed the other day by a lady, and she said, during my first pregnancy, my husband was studying to be a doctor, and he was hardly ever home. During my second pregnancy, 4 years later, he had finished his studies. He was home every night, and he would talk to my unborn baby. I said, what would he talk about? And she said, well, he just talked about the weather outside and the dinner we had. And then he would say, all right, Junior, well, it's time to go to sleep, so talk to you tomorrow. Good night. When this child was born, the lady continued, he walked into the delivery room. He approached me. My son was resting on my breast, and he lifted his hand and he said, hi, Junior. And my son just turned around and looked at him and gave him this beautiful smile of recognition. Like there was no doubt at all that this child recognized the voice, recognized his father. And I should add, what this lady said was that now, several years later, the relationship between that son and my first son and my husband is so much better than the first son. And she thinks, and I would agree, that it's because of prenatal bonding, that the two of them, bonded before the child was ever born. So I would very much encourage your listeners, when they get pregnant or if they are pregnant now, both mother and father to talk to the baby when the baby is awake, of course. No point in waking it up. It needs its rest. But when the baby is awake, and you know that by its movements, then talk to the baby, tell them how much you love them, tell them how much you look forward to seeing them when they are born.
That's a beautiful story. Yes. What would be a part of talking to the child? What would be other important aspects of bonding with the child before the child is born?
Before birth?
Mm-hmm.
Well, talking to the child is very, very important. Singing to the child is important. You can dance with the child, so that which is very, very good. It helps to develop its balancing system. You can also play music to the child. I recommend classical music, Baroque composers, especially Mozart, not because of my taste, but because research has shown that children really like Mozart. Do not play any very loud rock and roll type of music. Babies don't like that. You can also play with the baby during the last trimester by pushing in with one finger into the womb, then pushing in on the other side. Within a few minutes, the baby is going to pick up the idea that you're playing with it, and it will push its hands against you, which women tell me is the most amazing experience.
Really?
Yes,
I'm so
yes.
unfortunately, I didn't know this before.
I didn't know it either. But women tell me that it's just amazing because, like, suddenly you realize that there is an intelligent being in there. It's not just a blob of protoplasm. I mean, this is what people have to realize. A lot of parents think, oh, well, we'll worry about the baby once it's born. No, you got to look after the baby from the moment of conception. So you can do all those things, of course, and of course, get a lot of rest. Go for walks in nature if you possibly can. That's good. That's good for you, and whatever is good for you is good for the baby. Look at your relationships with your husband. It's very important to have a good relationship during your pregnancy with your husband. It's also very good to have a good relationship with your mother. If you do not have a good relationship with your mother, don't have her be present at the birth. Sometimes mothers like to be present because they want to help, which is fine. I certainly respect that. But if you have a complicated relationship with your mother, it's best not to have her present at the birth. And the same thing, of course, with your obstetrician. I mean, if you have an obstetrician or a general practitioner who's going to deliver your baby, make sure that you really get along. Any kind of hostility, any kind of negativity is going to get in the way of a successful, easy birth. Sometimes people have very difficult births and they don't know why. Well, one of the reasons is that they are frightened, anxious, and they are not relaxed. And if your uterus is not relaxed and your cervix is not relaxed, you can't have a good birth. So it's very important to be surrounded only by people who love babies and who, they're friendly. Like you want to have friends around you, including the obstetrician. And I think it's really good to have a midwife or a doula present, especially if you're going to have a birth in a hospital. I think it's very important to have someone who's going to advocate on your behalf, someone who can go to the nursing station and say, my patient, whatever, has not had anything to drink for the last 3 hours and she's getting very dehydrated, that kind of stuff. So I'm very much in favor of having a doula or a midwife at your birth, even if you're going to have it at the hospital.
Women choose the obstetrician not based on the relationship dimension, but on the professional dimension. Like, this person is good profession wise, but they don't really check this if we have a chemistry check. So do we have something for women to, one more point to convince them to actually go with how they feel with this person more than just, if this person is good enough?
Yeah, I think that's a very good point, Kate. That's a very, very good point. My mother would not go to a doctor unless they had 40 people sitting in the waiting room. If they had only 2 or 3 people waiting in the waiting room, she would say, "Oh, he can't be a good doctor. Not enough people are going to him. You should not you should not judge a doctor by the number of people in the waiting room or whether he is the head of the department or not. Sometimes the very people, and I just say sometimes, obviously this is not a rule, but sometimes the very people who are the heads of department are very good academically, but they could be terrible in terms of delivering a baby. So I think you should go by your friends, like try to find out, who had a good obstetrician. Now, what's a good obstetrician? I think that any person who probably gets a degree and becomes an obstetrician in your part of the world is probably very good technically, like they know what to do technically. But what I'm talking about is personality. Will they allow you to have the kind of birth that you want? Will they force cesarean section on you because it is more convenient for them? It's much more convenient for a doctor to schedule a surgery for Friday morning, 11 o'clock, than to suddenly be surprised in the middle of the night and have to go to the hospital. But this baby is not for the obstetrician. It's for the parent, right? So, like, we are not serving the needs of the obstetrician. He is supposed to serve our needs. So, I want your women and parents, future parents, to remember that he is not doing you a favor by delivering your baby. You are doing him a favor by going to him and paying his bills. That's how we can afford to live the way he lives. So people have this thing kind of turned around the wrong way. And if women will start seeking out obstetricians who will follow the kinds of steps that we are talking about, a much more human kind of birth, essentially, okay, where the woman has a say in what happens, then eventually the obstetricians who follow the footsteps of these are going to do very well financially, which is going to impress the other obstetricians. And this is what I've seen worldwide. Then they will change because money speaks. Unfortunately, I have to say that. And so, when they see that obstetrician A is having more patients and I'm getting fewer and fewer patients every month, they might to rethink how they are practicing obstetrics and might be able to shift, change, modify. Also, very often it's the wives of obstetricians who persuade them to change. And so, one of the things that you can work on are the wives of obstetricians and doctors because they're more open minded. They didn't spend 11 years studying. So, they're more open minded.
Hopefully that's, there are more and more people, but I feel it's, we definitely need to create the demand for the difference.
Absolutely. You need to create a demand for the difference. And this is what your program is doing, I'm sure, right now, and your other programs. Yes. And that's why I'm so excited about the program that you have.
Thank you. Dr. Verny, I wanted to talk about the experiences before birth and the mental health of parents, I would go, even
Okay.
talking about parents. I cannot citate, but I remember there was a study in Sweden where they were showing basically that if the mother is having depression during the third trimester, that increases the chances of premature birth. But if the father has the depression during this third trimester, it increases the chances of premature birth even more. So I'm wondering, why is this the case, and what would be your comment on this research?
I'm not familiar with that particular research. I think you would have to ask that question of the people who conducted the research. Yeah.
Yeah, I understand,
But on the same subject, I mean, there's absolutely no doubt that the emotional nature of the pregnant woman, whether it's depression, anxiety, stress that we talked about before, all of that, of course, has an impact on the unborn child, and especially if the woman is depressed after the baby is born, postpartum depression, that can be very, very difficult on the child. Also, in terms of what happens, like I said, before even conception, like, for example, fathers smoking before conception has been shown to affect the child that will be created after conception by the same father. Those are things that we are just beginning to explore. It's in its infancy, but that is going to become more and more prominent, I'm sure, as time goes on, which is why I say that, practically speaking, young people who are thinking perhaps of having a family, eventually, let's say 2 or 3 years or next year, it's very important to live a healthy life before conception. No smoking, no alcohol, as little stress as possible, just living a really healthy and happy life. And then you are going to have, well, there's no guarantee, but you increase the chances of having a healthy child if you live a healthy life before conception and, of course, during pregnancy. I think that's so important.
Yeah. I wish our society would be structured in such a way that many people can have these experiences, but
No.
unfortunately, that's not the case.
No, it's not. No, it's not. But there are people who can do this, who are able to, and are not doing it. And so it's those people that we need to reach. Even if 10% of the people start changing, then, big changes will happen in the future. We have to start somewhere.
No, I agree. Dr. Verny, you were mentioning like that some people saying like we will start to care about the child when the child will be born. Because the child in the womb doesn't understand anything, doesn't learn
Right,
anything, doesn't
right.
feel anything. What actually the child can feel and learn and
A
understand
lot.
being in the womb?
A lot, a lot. Quite a while ago, Anthony de Casper, a psychologist in the United States, conducted a very interesting experiment in which he had two groups of mother read a story to their unborn child. And one group of mothers read one story by Dr. Seuss. I don't know whether you're familiar with that. And another one, a similar story by someone else whose name I have forgotten. The mothers also recorded the story. So each mother recorded the story that she read to the baby and the one that the other group read, but she did not read, but just recorded. After the babies were born, the babies were put on, what did he call it? Oh, yes, he called it the suckometer. In other words, suck-o-meter. And it consisted of a baby bottle that was connected to a machine that counted the number of times the baby sucked on the bottle, and that was connected to a computer. And the computer was connected to a device that played back either one story or the other story, depending on how the baby sucked. To make a very long story a lot shorter,
No, that's interesting. Yeah,
okay, so what happened was that after birth, sometimes 2 or 3 hours after birth, the babies were exposed to both stories, the one that they were familiar with, the one that they were not. All of them, without exception, I think, started sucking in such a rhythm. It was set up so that if you suck more often than your basic, you're going to get one story. If you suck less than the basic, let's say the basic suck rate was 8 to 10 sucks per minute. If they suck more than 10, they got one story. If they suck less than 8, they got the other. Anyway, the point is that within a few hours, the babies learned to suck in such a rhythm, every one of them, that they got the familiar story as opposed to the unfamiliar story, which is amazing, absolutely amazing. One of Dr. Casper's students, she went to another university. Eventually, she repeated the experiment with women just singing a melody without words, just humming or singing a melody. Same thing, suckometer, two different melodies. Babies picked the melody that was familiar to them. In answer to your question, what do babies remember? They seem to remember a lot. It's just that they forget, of course, after they are born very quickly, they forget. But another aspect of what they remember is that quite a number of people, when they were bathing their babies and they were very relaxed, sometime between the ages of 2.5, when they are able to speak fairly well, and 5. So sometimes between 2.5 and 5, you're bathing a baby, baby's relaxed, there's no stress, you're in the bathroom, whatever, bathing the baby, nice warm water. You ask the baby, do you remember anything about your birth? And it is amazing what children will tell you. And I have descriptions of those kinds of stories. And they remember with absolute clarity. What was it like when you came out? It was light. It was cold. The kinds of things that babies tell you. It is amazing. Dr. Chamberlain, David Chamberlain, who did some hypnosis with couples, and the couples were the mother and her grown-up child. And he put them in a trance separately from each other. And on those occasions, he took them back to the birth of that particular child. So he wrote down all the things that the woman said about the birth, and then at some other date, all the things that the child said. There was incredible symmetry between what the child said. But when there was a difference, this is super interesting. When there was a difference, the woman said, we came home in a blue car. And the child said, we came home in a gray car. Then Dr. Chamberlain tried to get in touch with the father or a grandfather or uncle, somebody who was there when the mother brought home the child. And it seems that the child's memory was always correct. It was more correct than the mother.
And it's not one story, it's like
Repeatable stories,
counts of
16, I think 16 different pairs. There was one child, one out of the 16, I think, if I have it correctly, one out of the 16 who got it totally, totally wrong. Everything was wrong. And so Dr. Chamberlain looked into the birth of this child, and it seems to have been a very long, like 36-hour long birth, very difficult
Person.
birth. And his idea, and I would support that, is that there was so much stress, which means cortisone, as I've described to you before, and adrenaline. And when there is that much stress, it wipes the memory clean. It interferes with the laying down of memories. And so that child did not remember correctly anything, but the other 15 did. There it stands, like nobody has shown that to be incorrect. I wish, more people would do that kind of research, but I'm not aware of anybody having duplicated that, but it should be duplicated, perhaps in Cyprus.
Before we started the conversation, you mentioned the article from the Psychology Today about the C-section, unnecessary interventions. But also what I wanted to ask you about other routine interventions that became a very common, let's say, anesthesia, epidural anesthesia.
Well, epidural is not so bad. What is bad is fetal heart monitors.
Why?
Because what you're doing is that you're putting instruments into the uterus, onto the head of the baby, which is not particularly comfortable, I'm sure. I think forceps deliveries are, big problem, but fetal heart monitors, I think, are probably the worst. And I was invited to speak in, I'm pretty sure it was in Belgium. So it was the Royal Obstetrical and Gynecological Association. And kind of stupidly, my subject was gynae gadgetry, the unnecessary use of gynae gadgetry. This did not go over well with obstetricians. They live on that. That's their daily bread, But they were polite. But they did not applaud too much. And I was never invited again. But I think I really believe, that natural childbirth is the best. Water birth, is wonderful if you can do it safely. And that any of these interferences, amniocentesis, particularly when you're putting a needle into the uterus, I have seen on screens babies actually moving away from the needle, trying to push it away with their hands. And again, it shows how intelligent these unborn babies are. So I really see very, very little need for any of this gynae gadgetry. Also, the other thing, of course, that happens is that the nurses become totally focused on the fetal heart monitor. And instead of being focused on the woman and what is going on with her and what is going on with the baby, they're just watching the machine. And this again makes the woman anxious, tense, and she does not receive good nursing care. So my time is kind of up. Perhaps if we could.
Dr. Verny, thank you so much for this conversation. Very insightful. I'm super passionate about the birth and everything connected to the birth, and really sure that we need to advocate for difference.
Absolutely.
So that's my goal, and that's my passion.
I think it is a wonderful goal, and I hope and I wish you a great deal of success in it.